Good morning. Thank you so much for joining Forge Breast Cancer Survivor Center's Coffee Conversation. We're very excited to have Dr. Laura Bunch. I said brunch. I'm hungry. With us this morning. And so she's going to talk to us about some breast cancer 101 basics and updates. So very excited to have her here with us this morning. So if you could, Dr. Bunch, could you give us an introduction and just tell us about you and the things that you do, how you ended up where you are?
Sure. So I'm originally from Jackson, Mississippi. And then I went to medical school at South Alabama in Mobile, and then did my internal medicine residency in the Birmingham area when it was Princeton, Montclair. And sadly, Montclair's not there anymore. But interesting enough, when you're an internal medicine resident, you do a general medicine clinic and then you do a specialty clinic. And it turns out my specialty clinic was oncology with Dr. Lasker, who is now retired at Princeton. I'm married, I have 4 children. I have practiced in Mississippi, Texas, and Alabama. And interesting enough, it's like now kind of come full circle. I'm back at Princeton with Alabama Oncology, thanks to Dr. Vance, who reached out to me. And I just love working with her. And she is just such a positive spirit, and I like her philosophy on how she handles oncology patients, and we just have a wonderful staff there. And so it's kind of a full circle moment that brought me back to Princeton at this stage in my career.
So in all of the states that you've practiced, is Alabama your favorite?
Well, that's such a loaded question. My Texas friends will be like, each place has a special memory, but yeah, I mean, I love Alabama. We decided to move back here because my husband's from Alabama, me being from Mississippi, and we wanted to be closer to family because when we were in Texas, it made it hard being away from especially grandparents with the grandkids and everything. So
yes, for sure.
Very comfortable and back at home.
Happy to have you here. Thank you for coming back. So first, we want to kind of dive into the topic a little bit. And, when we think about breast cancer 101, I think that it's something that we can always kind of delve into. I think, especially for individuals who don't have a history of breast cancer in their family, or just kind of have certain ideas about what does breast cancer mean and what does it look like. So I'm really excited to be able to kind of talk to you about those things today. And so in knowing that, like if a person, like I said, doesn't have any history or knowledge about what breast cancer truly is and what it means to be diagnosed and how a person is diagnosed, what are some things or misconceptions that you've experienced and heard of in your field of work that you kind of would like to shed some light on today?
Well, sure. Well, I think, first of all, just people hear cancer and then they just freeze. It's the fear factor. It's the unknown. It's, all of a sudden if they hear that, they're like, oh, am I dying tomorrow? It's so many emotions at one time. What we try to get out there, of course, is again, just early detection, screening. We have gotten much, much better, still lots of work to be done. And that's where, of course, some of our patients can be our biggest advocates because you never know who's listening. And a lot of times, even my own family members, they listen better to their close friends or to their neighbors or to their church member or someone who they have just that connection with, that they listen and go, oh, I need to go get my mammogram or my colonoscopy. But I think that's the biggest thing, is just that misconception of, or I hear so many people like, well, I just don't want to know. I'm like, yes, you do. You want to know. Knowledge is power. We don't want anyone to have to deal with this. But again, we want to find it early if it is there. And that's, again, where screening and early detection are just so important versus kind of putting our heads in the sand and trying to pretend it doesn't exist.
Right. And then I like that you said, like, it is important to know because in families, especially those that are more so private about their diagnoses, right? Like it's not even just about you anymore. Like if you have daughters and nieces or just family, right? If you're that one person in the family that has it, like goodness, it could be so helpful for someone else who could probably jump ahead of something if possible.
Right. You you hit the nail on the head, so to speak. It is hard because a lot of families, some of the older generation, I do see some cultural differences. Some families just, they don't want to talk about it. They don't know. Of course, some people don't know if just because of different family situations. But again, knowledge is power. And so it's so important to share that, so that people can be aware and make sure they do early screening, or just know, hey, mention it to your doctor. By the way, my mom or my aunt or, someone has this cancer, so they can make sure that's at the forethought of their head when they're, taking care of you, to make sure that you're being properly looked after and screened.
Yes. And so if we're kind of talking about stages a little bit, I guess, like if we're starting at the beginning, you've just been told, hey, you have something that we need to kind of address, and it's breast cancer. What is a healthy way, let me emphasize a healthy way that somebody can get the best information about breast cancer and their treatment? Because we tend to get news that we don't know what to do with, and we Google it. And then we're like, oh my God, I'm going to be dead by noon today. I'm not going to even make it through the day. And so what are some healthy ways that someone can become more informed about breast cancer in general? And then as it relates specifically to them, what are those steps kind of look like? Of course, they're not going to know everything in a day, right? Because you just got the news. So kind of walk us through that if you could. What does that process kind of look like, and what are some healthy ways someone can navigate that?
Absolutely. And that's where, with any diagnosis, Dr. Google then you can go down rabbit holes. And the problem is, again, one size does not fit all. And we are all different. And even early stage versus late stage will, again, different subtypes. Everyone's medical situation is different. As far as, are you in your 30s or 40s versus 70s or 80s, and other comorbidities and other medical issues that you have. So first thing I just tell people, just first of all, breathe, take a deep breath. I think it's so important to have a support system. I always encourage, some people, again, are very private, or they don't want anyone to come with them, but having someone come with you to an appointment, having a second set of ears to listen, because so much is being thrown at you. It's easy to get overwhelmed, and you just hear only the first or second piece of information, and all of a sudden, sometimes we keep talking and we're going through our list, and then we realize people didn't even hear, a fraction of what we said. I think it's very important to bring with you a list of questions. It should be a two-way street with your doctor. It is a team approach. You're not going to get everything answered at once. And it's very often when I see people on their first diagnosis, and, they're already asking me, well, what about this, and that? Yeah. And they're already asking several things down the line. I'm like, let's kind of stop and take it as it's a very systematic approach. And I try to communicate that with them and go, let's take one step at a time. And then I think it's just, again, it's in every office visit is a reevaluation. It's a new step every time. Okay, now we've completed this part. Now we move to this part. Because as there are so many different instances, you can have someone who has an early stage 1 cancer, but biologically it's differences. So some people will, again, need different treatment approaches. And I think that's the biggest key when I try to tell people, because they all know someone who's had a cancer at some type, and it may be breast or it may be a different type of cancer, but then they immediately think, oh, I'm going to have those same symptoms that person had, or, is radiation going to burn me up? Is chemotherapy going to make me sick? The surgery. And that's just human nature. We relate it to whoever we know has gone through that process. But that process is constantly changing. And again, 10 years ago, 20 years ago, it's a totally different animal. It's just not even the same conversation. So if you have a relative who had, breast cancer in 2000, well, today it's totally different. And so I try to let people know, let's look at you, let's look at your situation. And then again, that two-way conversation of what do we do now with your particular cancer, your stage, your body, and then we move forward. And then once you know some of that information, absolutely, then if you want to, some people do, some people don't want to look online and I tell people, take it with a grain of salt, and please always ask me or whoever your doctor is, when you look up that information, don't just read it and then not come back, or come back and say, hey, I read this information, help steer me in the right direction. But once you have just some of the basics of, this is the type I have, this is the stage I have, then definitely, there's a lot of good online resources for patients with the American Society of Clinical Oncology has a patient portal. You've got, of course, the American Cancer Society. There's a Susan Komen Foundation. I'm sure y'all have some great links online. So but again, sometimes too much information can overwhelm you in the beginning. I think it's just, again, kind of take a step back, have your list of questions, have a listening ear with you, and then take it in a very stepwise kind of flow chart type pattern.
Yes, and I think the hardest part of that is just like, I want to go ahead and know everything that's
Right
going
now,
to happen
absolutely.
and when it's going to happen and what are the side effects. But I mean, basically, I'm hearing you say it's so subjective, right? You might be the same stage as someone else, but your hormones are different and your body responds differently. So your treatment is going to take a different amount of time and the method is going to be different. So just talking with your doctor about that. And one thing that kind of leads into my next question that you mentioned, when you think about breast cancer 20 years ago compared to today, it's completely different. So in what ways has breast cancer treatment changed over time?
Oh,
I know that might be loaded.
so anyway, well, I mean, all right. So even going back to my own grandmother had breast cancer, but again, this was way back in the early 1980s. And, it was just total mastectomy, total axillary lymph node dissection. She suffered with chronic, horrible lymphedema afterwards, had surgical complications. And not that that can't happen today, but, on so many aspects of it, from, again, early detection. So again, if we find it earlier, it's going to be smaller, it's going to be a less invasive surgery. We've de-escalated the surgical component to as much, breast conserving, breast saving therapy with equal results in most situations, not all situations, obviously, every situation's different. So, I mean, there's so many aspects to so again, it's whether you need surgery, do you need chemo, do you need radiation, do you need pills, depending on what subtype you have. At every stage, we have modified and thankfully made a lot of advances in that aspect. Again, used to, if you were above a certain size, even early stage, everyone got chemotherapy. Now everyone doesn't need chemotherapy because we do have some tests such as like Oncotype DX. It does tissue profiling for your specific type of cancer that can put you in a low or high risk category and go, hey, actually, you would not benefit from chemotherapy, or yes, you would, to try to decrease the chance of it coming back. So that's wonderful that, again, when it's needed, chemotherapy works wonders and makes a huge impact on, lifelong prognosis and your chance of recurrence. But if you don't need it, then I don't want to put you through that treatment with those potential side effects if you're not going to get much benefit. So it's just, again, in every step of the way, from surgical aspects to, again, identifying who would benefit from further treatments or not, to, again, radiation therapy techniques have gotten so much better. And just in every aspect, it truly is just so much different than it was 20 years ago. It's a blessing.
Yeah, and I mean, if it hasn't developed in 20 years, I think that we would all just be running with our hair on fire if we have not improved in some way in treatment. So that is very reassuring, and I'm sure we'll look 20 years from today and
Exactly.
what are we doing? That was so archaic. That was barbaric. Like, why were we doing that?
All right.
And so, I mean, it's good to know that, research is continuing and lessons are being learned and new developments are being made. So that is exciting. And I guess I don't know the ins and outs of clinical trials and how that process works, but that is something that I believe is a part of that process, and learning more about different methods and medications and things like that. So if you could you kind of tell us a little bit about clinical trials? What are they, and how could someone learn more about a clinical trial when they're going through their diagnosis to see if something like that would be more helpful for them?
Absolutely. I mean, clinical trials are the reason we have all these new advances and outcomes. And of course, the purpose of a clinical trial is to help with, new drug developments or even vaccines or certain even medical equipment to see how can we improve patient outcomes. And it's just so important for people to consider being part of a clinical trial, because that is again how we learn. And also trying to get more diversity in our clinical trials and get people of different ethnic backgrounds, even socioeconomic backgrounds, access to care. All that helps us so that we can do better in the future from what we've done in the past. A lot of the organizations in town, I know with our group, we have clinical trials, of course, UAB, MD Anderson, there's a lot of national trials. Once you get to, again, the point of your diagnosis, your stage, you can see if, again, you would benefit or could possibly be part of a clinical trial. But I always encourage people to look at that because, again, that's where we get our new information from and so many advances, thankfully, because people who, they focus their entire career on research.
That's good to know. I'm glad I wasn't too far off.
Not at all. Not at all. No.
So when somebody is diagnosed and they've brought their listening ear, they've written down their questions, but they still go home and they're overwhelmed. Because it's breast cancer. It's hard. It's quite a journey. It looks different for everyone's. No journey is the same. How can someone kind of lean into healthier ways to address some of that discomfort and the unknown, because a lot of it is the fear of the unknown, and kind of assuming what you might feel, because when someone thinks of chemotherapy, they do think of, immediate hair loss, and they think of all of these other different things, but that might not be the side effect for everyone. So how do you kind of think a person dealing with those types of anxieties could go and process the information in a healthy way, and also be able to make those steps forward and make those necessary decisions when it's time?
And again, that's communication is just key. I think for most women, especially with breast cancer or with any cancer, but for most women, we're the caregivers for everyone else. Whether you're married or not, whether you have children or not, whether you're a daughter, a sister, a friend, you take care of everyone else, and then it's hard to sometimes step back and let other people take care of you. And I think that is huge. And the fact that accepting help, reaching out for help, not being afraid to ask for help, and no stigma asking for help. Whatever your support system is, it's different for every person. Some people, meditation, some people exercise, some people, again, just keeping their same routine, working and staying busy so that they don't sit home and dwell on things. I truly believe it's, mind, body, spirit. You can't ignore one or the other because they're all interconnected. I think it's, again, just finding what works for you. And also just the main thing is just talking to someone, whether, again, there's support groups that are wonderful. And there's so many different ones between private groups. A lot of churches and organizations have groups. You can get contact information from like our group and other groups in town. They will have contact information of people who to reach out to. And you're right. And it's trying to find that healthy way of dealing with it, because it can be just so overwhelming. It's financially overwhelming if you have to temporarily stop work, or if you are not working and you're on a fixed income or you're retired. I think that's a part that people don't talk about enough. And thank goodness, there are grants out there that can help people with, co-pays or their electric bill or transportation. I know the radiation oncology group at Princeton recently got a national grant that helps with transportation issues, because especially for radiation therapy patients, they're going 5 days a week. Some people just can't do that, or they have to, they may not have a vehicle, or they have to ask a family member who has to take off work to take. I mean, there's just, like you said, there's so many different scenarios, and everyone's situation is different. Um, and it definitely, it just can be overwhelming. So I just ask people to, again, communicate with your doctor, communicate with other people on the staff. We have, a nurse navigator, we have a charge nurse, our nursing team, that everyone can bring something different to the table. And we try to keep a list of things going of, okay, we have this group or this organization, one place I used to work, there was a wonderful church volunteer group that they had volunteers strictly to bring people to appointments, because that was such a huge aspect, especially in sometimes the rural community. And again, even in Birmingham, because we don't always have the inner city transportation that we need for people. So again, communication, support, don't be afraid to reach out and ask, and also know that it's a temporary thing. It is a temporary roadblock. I tell people, especially I see people who have never been on medication before, and they're like, oh, I don't want to take an anti-anxiety pill, or I don't want to take a depression pill, or they're afraid to even take a nausea pill because they've never taken anything before, and they've been blessed with, being very healthy. And I'm like, this is temporary, but we don't want you to be sick. We want you to get through this short term. There is the other side.
Thank you so much, Dr. Bunch. And one final thing before we let you wrap up with this. So I know we kind of mentioned where we talked a little bit about just new developments in breast cancer treatment and clinical trials. Have you heard anything or do you know of anything that's kind of like on the horizon as far as surgical interventions for breast cancer at this time?
Ooh, I'm not off the top of my head, and not being a surgeon. And if you see me with a knife, run away. I'm not a surgeon. But I mean, I do know, just again with tumor board and talking with my surgical colleagues, again, it's amazing how it's just constantly changing, and really with the focus being on breast conservation when possible. But again, it's so individual, because breast sizes are different, tumor sizes are different. Thinking long term, if they're, from a cosmetic standpoint, which is also an important aspect to patients. In certain situations, you can do chemotherapy up front to downsize the tumor, and then lumpectomy or breast conserving therapy is an option when it wasn't before. I know there's some nipple sparing mastectomy. So there's a lot in the wheelhouse. I will defer that to my surgical colleagues.
Yeah.
But again, the biggest thing is, when I look back, especially like 10, 15 years ago, the majority, almost everyone had a mastectomy, and not everyone needed a mastectomy. And that's fine and again, different reasons people may choose that, because of personal anxiety or preferences or family history, or they have really dense breasts and concerns for monitoring the future. That's why everyone is so different. And that's why that key of that talking to your surgeon, to your oncologist, is so important. And just, if they're not willing to talk back with you, well, then you talk to someone else. I tell people, it's your body. You should feel comfortable with who you see. And if it is not that team approach, then that's not the right person for you.
I love that. And a lot of people don't think that when they're getting their breast cancer. I mean, it can be difficult to get to that space mentally, because you're just stuck on the fact that you even have breast cancer. Wow. And you think that whatever is in front of you is the blueprint of how it's going to be. And to know that there are options that you can, shop around with different facilities, different treatment centers, different care teams, to see what's a good fit for you, because it's just going to make such a huge difference in your treatment when you're more comfortable with who's taking care of you. Because literally your life is in their hands. And so it's okay to say, you're not my cup of tea. I'm going to go ahead and try something else.
And again, of course, now on that flip side, we don't want to drag it out.
Right. Maybe not 2 years, maybe sooner than later. But
it is absolutely reasonable. And again, I mean, hopefully you find that person right away and they have, good communication with you and they're explaining and you're like, yep, let's get this ball rolling. But if for whatever reason you're like, I'm just not sure, or you just you want to make sure this other person, because of course we train different places, we have different philosophies. There are many ways to go about it. But if you also like, I want to hear their opinion and make sure we're on the same page, or that I feel comfortable with my decision, absolutely. It's your body, it's your life, and you should feel absolutely comfortable with whoever you're seeing.
Thank you so much, Dr. Bunch. Do
Welcome.
you have any other final thoughts you'd like to leave everyone with today? I know we've covered a lot of things,
Yeah.
but if you had anything you want to make sure they took away from this, what would that be?
Again, screening. Don't be afraid to ask questions, and communication, and you got this.
Well,
If you're not sure, you got it.
thank you so much.
You're
Um,
welcome.
really appreciate you being able to carve out some time to talk with us today and give us some information, right? And just laying out the hey, remember to, like you said, get the support that you need, talk to whom you need to talk to. It's okay to take it a day at a time. It's not all going to happen in the same day, and we don't know how it's going to happen, but we're going to do this together. So thank you so much for talking with us today, Dr. Bunch. It was such a pleasure to have you.
You're welcome. Thank you.